Okay, so now we've got Donna who's going to speak to us. She's from the Faculty of Health, and she's going to look at innovative technology to support learning in undergrad nurses. Take it away.
Thank you. Everyone can hear me okay? So yes, my name is Donna Wilson and I'm currently enrolled in a PhD at Southern Cross University. Just a little bit about me for context is my background is a clinical intensive care nurse, and as I moved into education and academia, my interests have moved into mobile technology and supporting education in that unique clinical environment. So today I am presenting an example of my in-candidate to review. Has anyone not yet done their in-candidate to review? So I think most people in the room have. So for everyone who has done it, I hope it just serves as an interesting insight to the work that I've been doing. But if anyone would like to ask any questions about the ICR, because I'm quite recently completed it, I'm happy to catch up later. Okay, so the title of my work is Using Mobile Technology to Support Innovative Work Integrated Model in an Undergraduate Nursing Degree in Australia. I'd like to acknowledge my supervision team who are up here on the screen. And also, I'd like to begin by respectfully acknowledging the traditional custodians of the lands that we work, meet and study. This image is taken from my home, which is on Bundjalung country, but today I'm on the lands of the Yugambeh people of this region of southeast Queensland. And I honour their enduring connection to this land, recognising that it always was and always will be their home. Okay, so this slide is to give a bit of a quick overview of my presentation today. Firstly, I'll briefly discuss the background and rationale for this research, and then I'll highlight the findings from my integrative review, which was published in 2022, and discuss how these findings informed my project's intervention. I'll then provide an overview of my methodology and introduce the 3 phases of my research before exploring my first results chapter briefly. Finally, I'll finish up with my PhD candidate to timeline and completion plans. In order to begin talking about my research, there's a couple of key terms I think it's important to clarify. First of all, work integrated learning, which I often refer to as WIL, so forgive me for doing that. Also, please forgive me for relying heavily upon my notes today. So WIL, this is where academic theory is integrated into workplace practice opportunities to develop students' personal and professional skills and their workforce readiness. Undergraduate student nurse examples of WIL would be places like hospitals or clinical environments where they go out there for their clinical part of their education. Clinical facilitators, so for my research, these are registered nurses who educate, support and assess the students' performance on work integrated learning. So they're not necessarily educators per se, but they're practicing professionals. So the background of my work, a major contemporary issue in nursing education, as with many fields, is bridging the theory to practice gap. It's well documented that student nurses can face difficulty transitioning from their theory-based learning on campus out there into that real-world practical application in healthcare settings. Secondly, we've got the unique WIL settings. So WIL situates the students in clinical environments, and they can be really unpredictable and dynamic, and they continually are evolving with technological advances as well. As we emerge from the post-pandemic world, it's never been more obvious that it's essential to look for innovative ways to integrate information technologies into our curriculum designs as well. So thirdly, we've got the use of mobile technology in undergraduate nursing programs being on the increase, and I think it is across the board with all other professions as well. And it's been found to facilitate timely access to appropriate information, and also the 4th point here as well, improving communication processes. This can lead to, both of these can improve the students' motivation, engagement and critical thinking, and autonomous and independent learning styles as well. Communication also relates to the clinical facilitators too, which is important. They've often reported a lack of insight into the students' current scope of practice when they present within that WIL environment, and also managing communication and assessment processes during that unique WIL situation. And finally, the research is timely because there's a growing need to explore innovative models of WIL to improve student and clinical facilitator experiences, and particularly as we're faced with additional barriers in that WIL environment, with workforce shortages and changing environments post-pandemic as well. So in 2022, I published this integrative review, which is now the second chapter of my thesis. In the integrative review, we found two key themes. There was accessibility of learning resources and effective and timely communication. And this provided a guide to describe how the use of mobile technology can support work-integrated learning in undergraduate nursing programs. So what we discovered is that whilst technology is recognised as an innovative tool in healthcare education, there's little research investigating the use of it with nursing students and clinical facilitators in the WIL environment. So armed with this knowledge, we set about to develop an innovative mobile technology intervention that we called M-Preceptor to support student nurses whilst they were on a clinical placement or WIL that went for 3 weeks. So let's take a look at the design of the M-Preceptor program. The M-Preceptor is a web-based program and it was designed to be easily accessed via a mobile phone. I enlisted the support of an education technology company called Practera because I'm not a tech expert despite my chosen topic. And they provided the experiential learning platform and supported me with the development of the education program that I called M-Preceptor. So a little bit more detail, it provided a centralised place for WIL documents and communication, such as written reflections, which is an essential part of nursing education. It delivered the content in bite-sized modules designed for maximum engagement while minimalising any additional workload for the students. We intentionally didn't introduce any new concepts either. It was purely to link what they learnt on campus with what they were learning in the clinical environment. The M-Preceptor prepared and supports students for WIL, and the M-Preceptor also supported and prepared the clinical facilitators by providing clear focus points for them to focus on with the students and their learning. So the images here on the upper right-hand side shows the orientation activities and relevant orientation information, both to the M-Preceptor platform and program, but also to the WIL that the students were about to begin. The image on the lower left shows a glimpse of weeks 1 to 3 content, and they were specifically aligned to the learning outcomes and student scope of practice. And these were first-year nursing students on their very first clinical placement. As you can see, the design looks snackable or bite-sized, user-friendly, and delivers seamlessly to a mobile technology device, specifically a smartphone. So the aim of my PhD study is to evaluate the use of mobile technology to support innovations in a WIL model in undergraduate nursing education in Australia. It's a non-sequential multi-method study consisting of 3 phases, with each phase addressing a specific research question. So for phase 1, we used a pre and post survey with the intervention group only to investigate nursing students' acceptance and adoption of mobile technology using the validated Delone and McLean model of information system success. For phase 2, we conducted a quasi-experimental pre and post test with non-equivalent group using validated tools to explore the students' professional competence and satisfaction with their WIL. And for phase 3, the qualitative phase, we held focus groups to explore the clinical facilitators' perceptions and experiences with the mobile technology and how they experience that as a support for WIL. Methodology. So this figure is from chapter 3 of my thesis, titled The Diagram of Theoretical Framework, and it illustrates the methodology relationships within my project. Our research is underpinned by the philosophy of constructivism, the epistemology of situated learning theory, with the ontological perspective of pedagogy. Constructivism will allow us to view the learners as active participants in their education, who engage in critical thinking, and it's recognised that knowledge is co-created based on previous experiences, social and cultural contexts, and previously acquired knowledge, which is really important, particularly in nursing, with so much of their learning occurring out there in the field. This diagram also demonstrates how both pedagogy and situated learning theory sit within a constructivist paradigm. And situated learning theory gives us an opportunity to look at how knowledge is constructed through context and interactions within environments. It speaks to the unique combination of both the mobile technology and the WIL environment as the setting and the context for where the learning was occurring. The centre of the diagram depicts how we're investigating through a constructivist lens, accommodating both quantitative and qualitative data analysis. So a little bit more about constructivism. In this research, learning is viewed as a collaborative process where new information is aligned with prior knowledge, and it allows for multiple interpretations of realities to coexist. Nursing education requires a process of personal evolution for the learner, blending clinical skills and knowledge with the human aspects of nursing. And constructivism allows for diverse interpretations of reality, and which is very suitable for our varied cohort of nursing students and practitioners in the context of WIL, which facilitates active learning and social and community influences. The epistemology for this research, as mentioned earlier, also sits within a constructivist paradigm and offers a philosophical lens through which to view how knowledge and learning is occurring. I developed this situated learning theory diagram from my methodology chapter, but it's going to be instrumental in my discussion chapter later on, I'm hoping, as I've started theorising how unique situated learning theory relationships exist on work integrated learning. It begins with the student nurse at the centre, learning within legitimate peripheral participation, and this is within a community of practice on work integrated learning, and it's supported by mobile technology. So this diagram of theory may develop further as my understandings deepen, and it may help to facilitate my discussion chapter further. Situated learning theory allows us to emphasise how knowledge acquisition is tied to social interactions. So work integrated learning theory, and it mirrors situated learning theory principles. Learning through doing, observing, experiencing in the real world settings. And further to this, the mobile technology in the research expands our community of practice again, providing access to resources and enhancing modes of communication with the students and facilitators. And it's hopeful that it will help to reduce the cognitive load, enhancing learning immersion through legitimate peripheral participation. So phase 1 results have been submitted and are under review for publication after 2 desk rejections, but we're still hopeful. In phase 1, we investigated a Bachelor of Nursing students undertaking their first year work integrated learning placement. All students in this study had the M-Preceptor program incorporated into their existing curriculum. However, participation in the study was, of course, optional. Data was collected using that Delone and McLean tool, which is widely used for assessing the success of information systems. The variables explored in this model are seen here within the boxes, and we did have an extended version with those 2 yellow boxes as well. We employed structural equation modelling to test our enhanced model, specifically tailored to measure the acceptance and adoption of the mobile technology amongst the student nurses on WIL. So our research found that student nurses had good acceptance and adoption of mobile technology as a support for WIL, although the impact of COVID on the study should be considered as a confounding variable. In fact, it was a positive confounding variable because the mobile technology was very well suited for what occurred. So this platform was designed conceptualised 2019 and 2020, and the real full effects of COVID took hold, as you would know, in 2020 with our students out in the clinical environment. In the context of post-pandemic practices, investigation into the role of technology as a support for WIL is, particularly in times of increased social distancing, is highly relevant. And our findings suggest that nursing students' intention to use M-learning or technology in the WIL settings is really high when they've got high levels of the perception of its usefulness. So for our results, 5 of our 14 hypotheses were strongly supported in our analysis, the most important variables being user satisfaction, information quality, system quality, and self-efficacy. Phase 1 of this research provided really valuable insights into the key factors that influence nurses' acceptance and adoption of mobile technology. Limitations identified include contextual characteristics and cultures of individual WIL settings, such as rules that limit the use of mobile phones in clinical environments. Some facilities you were just not allowed to have a mobile phone on your person. And also internet access across various locations as well. So if anyone's ever worked in a hospital, you know that they're notorious for not having great internet service as well. Thank you. So this is my Gantt chart, my PhD timeline, and just to point out that where we are is the red square with the black dot around it is April, which is when I gave my ICR, and everything so far that I've discussed is above that, north of that. And I just wanted to point out as well that my journey started as a HDR master's student, and at time of my COC, I was fortunate that I was able to transfer straight into PhD post-COC. So my journey as a PhD student only started in 2022 officially, but this project has been going since 2020. So in case that was confusing. There has, of course, been challenges in the past several years that have impacted my HDR experience. I've moved through the strange times of COVID, as we all have, and experienced a change in my supervision team. I even managed to fracture my right hand quite badly, and I'm very right-handed. I'm not ambidextrous at all. But most significantly, my parents and extended family were greatly impacted by the serious floods in Lismore, losing homes and businesses. So it has been a really wild time. However, when I look at this Gantt chart, I think it demonstrates really positive progress that I've made. And another positive milestone that I haven't mentioned is I was able to deliver my phase 1 results at an international conference for ANZAPAY in 2023. And just my last slide is to look at my research journey ahead of me. So publishing phase 1 results, of course, then they're currently under review. So fingers crossed that's going to happen soon. I've already commenced my phase 2 data analysis. It's well on the way, and that second phase paper is being written as I am right now. And I'm also looking for the opportunity to disseminate phase 1 and 2 results at upcoming conferences. And I've applied for the International Nurse Education Conference in Singapore in October. So hopefully I'll hear results about that soon. But looking forward to next year, 2025, completing my phase 3 results and my discussion chapter and submission by the end of next year is my plan. That is the end of my ICR. I had a really positive experience with my ICR. The final thing I would say about that is that it was a really big moment for me to get to that and realise that the end is in sight. I can see it. It's not that far away, and reflect on how much I have achieved. And yeah, so that's closing up my presentation. Thank you.
Thank you. That was great.
Thank you.
We don't want to run too late, so we might just have time for one question. So I'm aware that people have lifts and flights to catch.
Well, actually, they're sort of both related. So it's just 2 questions, but they're very short. The first question was, when you say the modules are delivered in bite-sized chunks.
When I say what, sorry?
The modules, each of those modules available
Yes.
on the program are available in bite-sized chunks. How long is a bite-sized chunk?
A bite-sized chunk. So it was 1 item. So an example would be the first year students learnt how to do manual blood pressure measurement. So there would be a small blurb just to refresh them, and then a link to the video that was the same video that came from their online module.
Oh, yeah.
And then a reflective question or comment to sort of get them to think about, when you did your first blood pressure.
That's good, because I was going to ask you, the second question was at what point, we know that just even teaching in a real room, someone just a talking head at you doesn't lead to good retention and information processing and stuff. And pedagogy has a more active component to it. So that was my second question. What sort of activities built into the program itself?
That's where I had a lot of fun. For orientation, that's where I got a lot of creative license, because I wasn't allowed to really introduce anything too new. But I gave an ISBAR handover as an example. I gave them a written scenario of a patient in a room that had deteriorated just a little bit, so nothing too scary. And so they had to prepare an ISBAR handover to give to the nurse. And so these guys had never been in a hospital before, and they had to film themselves because it was on a mobile phone and they had cameras, and they had to submit it. And I got to watch hundreds of the students giving ISBAR, sitting at home in their bedrooms with their uniforms on and filming themselves. And it was really great, because the feedback the students gave me is that was their favourite activity, because that was the thing they were most afraid of, is actually having to, because the ISBAR handover for a nursing student, I don't know if there's any other nurses in the room, but in a hospital environment, oftentimes you're looking after all these patients and the doctors pop in because they're so busy in theatres or wherever they are, and you need to give them really quick, concise information. And if you don't do that well, it can be a point of conflict. And so you want to get it right. So we really put a lot of effort into giving that communication style, a lot of push. And the students, that was something they talked about. And the CTs, the clinical teachers, talked about that a lot as well. So there was a lot of that kind of doing, like learning through doing. So yeah.
Congratulations. Yeah.
Thank you.
It sounds like it would have been really fun to do as a student, and really would have enhanced, information processing and retention and confidence in the students as well. Yeah. Good on you. Thank you.
Thank you.
Well done.
Thank you.